Depression is a condition that affects people in many different ways. For some people, it may be a short-lived episode that is triggered by a stressful event such as a job loss or the death of a loved one. For others, depression may be a chronic condition that requires ongoing treatment. One of the most important things to understand about depression is that it is not a personal weakness or a character flaw. It is a real medical condition that can affect anyone, regardless of their background, gender, or age. There are several different types of depression, each with their own set of symptoms and treatment options. Some of the most common types of depression include major depressive disorder. This is the most common type of depression, characterized by persistent feelings of sadness, hopelessness, and a loss of interest in activities that were once enjoyable. Symptoms can last for weeks or months and can be severe enough to interfere with daily functioning. Persistent depressive disorder. This type of depression is similar to major depressive disorder, but symptoms are milder and can last for 2 years or more. Seasonal affective disorder. This is a type of depression that occurs in the winter months when there is less natural sunlight. Symptoms can include feelings of sadness, fatigue, and a lack of energy. Postpartum depression. This is a type of depression that occurs in women after giving birth. Symptoms can include feelings of sadness, anxiety, and difficulty bonding with the baby. There are many different treatment options available for depression. The most effective treatment will depend on the individual's symptoms and the severity of their condition. Some common treatment options include psychotherapy. This involves talking with a mental health professional to identify and address negative thought patterns and behaviors that may be contributing to depression. Medication. Antidepressant medications can be effective in treating depression by balancing brain chemistry and reducing symptoms. Lifestyle changes, regular exercise, healthy eating, and getting enough sleep can all help improve mood and reduce symptoms of depression. It is important to note that depression can be a serious condition that can lead to complications such as substance abuse, self-harm, and suicide. It is important to seek help if you or someone you know is experiencing symptoms of depression. In addition to traditional treatments, there are also a number of complementary and alternative therapies that may be helpful in treating depression. These can include acupuncture. This involves inserting thin needles into specific points on the body to help balance the body's energy. Yoga. This series of postures, breathing exercises, and meditation practices that can help improve mood and reduce stress. Herbal supplements. Certain herbs such as St. John's wort and saffron have been shown to have antidepressant properties. It is important to talk with your healthcare provider before starting any complementary or alternative therapies to ensure they are safe and effective. In conclusion, depression is a common and serious mental health condition that can have a significant impact on an individual's quality of life. However, with proper treatment and support, it is possible to manage and overcome depression. If you or someone you know is struggling with depression, remember that help is available and that there is always hope for recovery. Thank you for listening.